Hello everyone, I'm Dr. Nandini Teli here, MD dermatologist and cosmetologist at Alpha Hospital, Wakad, Pune. So here I'm going to discuss about the skincare routine that you can take during this self quarantine period. Okay, so we all are locked down at our own houses, and then we can't move here and there, and we can't go to the hospitals, can't go to the skin centers and everywhere. But I'm here to help you out so that you can take the minimum care that you can do at home, so that you can keep your skin fresh. Okay, so now I'll be discussing. Now I'll be discussing basically on types of skin and how to take care about the different type of the skin, and then we'll discuss about the do's and don'ts that you have to go on the different types of skin, and um, then the food what we eat, how it impacts our skin. So we'll discuss on that, and non-facial skin, how to take care about that, like the body skin, so how to take care of that. So so coming to the types of skin, so there are various classes, classification of the skin, but we'll go to the very common and the easy one, that is like oily skin, and the combination skin, normal skin, and the dry and the sensitive skin. Okay, so the oily skin. So oily skin is the one where there are lots of oil glands on the oil glands on the skin. Okay, so the oil glands. Okay, they are depend on the hormones of our skin. So depending upon our hormonal changes and all, the secretion of the oil also changes. So that's how the variation of the skins will be there. Okay, so in the oily skin, exactly, it is like in the age of 16 to 25, it's very common. Like the skin being oil because of the change in the hormonal changes. Okay, so so when there is and then there are certain cases where the oily skin can be seen even in the age of 30 to 45 also. So that's because of the hormonal changes and the hereditary factors. And so in this oily skin, so how do you identify what type your skin is? So in the oily skin, you will be having the larger pores, and like when you get up in the morning, you will see your T zone and the forehead and the chin getting sticky and oily. Sometimes you even see the tiny whitish discharges on the face. That's like a super oily skin, what you can say. Again, then so in the oily skin, the pores are larger, and you'll see very frequent blackheads and the whiteheads, and pimples, blemishes, you'll see. And then the skin will be dull, shiny, and thick complexion. Okay, and this is the type of oily skin. And then coming to the combination skin, in the combination skin, rest the some part of the area will be dry and some part of the area will be oily, and especially the T zone will be oily. uh, Especially the T zone will be oily, and yeah, and the area, few of the area will be dry. So this is a combination skin. So combination skin is also very common, and so the care what you have to take for the combination skin will be more. Okay, and then next comes is kind of is a normal type of skin. Normal type of a skin is a very lucky skin, where you have to not care too much about that skin, and so the complexion is even. There are less pores, and pores open, and the skin will be healthy, and there won't be any kind of a blemishes, like that. And then the dry skin is also kind of a problematic skin. So where you have a dry and the sensitive skin are like there will be kind of a itchiness, there will be kind of a dryness, peeling of the skin, scaling of the skin, and the pores almost are not seen in that type of a skin. And in the dry skin, they are like very easily damaged to the sun and are very much prone to the allergy. Okay, and the dry skin has a very high chances of getting wrinkles faster. And so these are all the types of skin. And how to take care about this skin. Okay, so in the oily skin, the care has to be a little bit more. Okay, so first thing is the cleansing. So oily skin cleansing has to be done with a salicylic or a glycolic based cleansers. So you'll get in market many salicylic and glycolic based cream. Now, especially you can easily find a Neutrogena oily face cleanser, or you can go for a Bioderma Sensibio, or you can go for other which are glycolic and salicylic containing, which will help in cleansing the pores. And next comes is moisturization. Yes, it is important to moisturize, moisturize in the oily skin also. Why? Because you have to remove the dirty oil and then you have to put on the good oil on the skin. So when there is too much of oil, so it has to be cleansed and then put the new moisturizer. So that is important. So especially you have to choose a non-comedogenic moisturizers in this. So what are non-comedogenic? So non-comedogenic are the one which doesn't block the pores actually. So they are like a water-based moisturizer, and you can choose a hyaluronic acid moisturizer. And do not apply any kind of oils on the oily based skin, and do not apply the thick cream based one, the liquid paraffin based one, the butters and the oil based moisturizers on the face in an oily type of a skin. And um, and yes, I just forgot, the cleansing of the face should be minimum 3 to 4 times a day, or 3 to 4 times a day in a oily skin. And then in the after the cleansing comes the sun protection. Yes, even though you are at home, in the home, you have to apply the sunscreen. That is very very important, that when you first miss that part, you have to apply that. Okay, and you're sitting in front of the computer most of the time, doing at home work. And you are continuously exposed to the UV rays and the infrarays from the computers. So all those things are the one which causes the like early aging and the damage. So sunscreen, do not forget. So minimum of a 30 SPF sunscreen is important. And again, there are different kind of sunscreen in that. So for oily based skin, it is on the silicone based or the water based sunscreen. And nowadays nanotechnology sunscreens are there. So those are all the very good sunscreen what you can do. And what you have to not do is picking up of the acne, popping of the acne. You should not be doing. So what happens is it will postpone the healing and delays the healing and leaving a bad marks. It will take a lot of time and a lot of money to clear that. And and what here important thing is, do not apply any kind of aloe vera gel or BB creams, CC creams, or any kind of like mousse and any kind of oils. Okay, so these all are going to make your skin more prone for acne. So very commonly nowadays we are seeing the new cases of acne. So in they are like, the patient tells, doctor, I had a very clear skin early, and I don't know nowadays it's causing more acne. I never had such acne. So this is because the products that are they are using. So the aloe vera gel seeing on YouTube, and somebody suggested, parlor suggested, they just go on applying the aloe vera gel in a very routinely based. They keep on applying that. So because of the gel based and there will be the blockage of the pores. And even the BB cream, CC cream are not good. You can go for a liquid foundation, that is the best one. We can use as a makeup, but never a BB and a CC cream. And the vitamin E capsule also is being used in mixed with the aloe vera gel. So that is also a wrong thing to be done on the face. And so these all causes the block pores. These block pores make they go into blackhead and whitehead, and these blackhead and whitehead pop up into acne when didn't have a good sleep, or when you are traveling, or when you are getting your menstruation, and lack of sleep. All these things can pop up the acne, and these acne will remain a scar and a mark. It'll take a lot of time to heal. So you can avoid. This is a very important thing. Okay, and just a second. Yeah, and next comes is a care of combination skin. Combination skin is same as that of the oily skin, but the number of face washes can be reduced, and the moisturizers can be used more intense than that of the oily face skin. And yeah, this is the same. And the yeah, normal skin, yes, it's very easy. You can try a lot of products on your skin, but yes, you also have to, normal skin people also have to avoid the aloe vera gel, BB cream, CC cream always. Okay, and they can yeah, they can go for different kind of masks and everything that I'll discuss later. And the um, um, dry skin people. Okay, dry skin will be dry skin have problematic skin. So dry skin people, they generally don't get the product, very less product suits them. So they have a very sensitive skin. Even when they use any kind of a simple moisturizer or some kind of a home remedies, they have a rashes on their face. So even those, when they go in the sun, then also they have rashes on their face. So some allergies, everything very common. So dry skin is like you have to take a lot of care about it. And uh, in dry skin, you can yes, you can go for a very intense moisturizer, and you have to use a very mild cleanser. So cleansers like acetyl alcohol containing cleansers are the best for the dry skin. So you get very commonly the Cetaphil, and Cetaphil cleansing. Nowadays you got a cleansing foam, and there are many companies which are doing this, which are giving the Cetaphil cetyl alcohol containing moisturizer. And the moisturizer used in dry and sensitive skin should be repeated and should be thick. It can contain some kind of oils. And sunscreen has to be more higher in the dry skin, so that more than SPF 50 will be better for them. And yeah, so these are all the things. So many patients come to us asking, "So can we do facials or not?" See, facials, we generally suggest not to get it done, because it is like we don't know what the products they are using, and we don't know the quality of the products. Yeah, that is one thing. And but it's totally no facials for the oily skin and the combination skin, because oily skin is already having a lot of blackheads and whiteheads. These are like a reservoir for new acne. So whenever there is this kind of skin, they whenever they get done a facial, within 1 or 2 days they will pop up with a new acne. And we very commonly come across the patients who are brides who get done a facial, and then suddenly they come up with a lot of acne, especially when they get a back facials, or the back waxing and everything. They get really a severe kind of acne. So those all are like problem in a oily skin. So generally avoid the facials and the face waxing and the back waxing in the oily and combination kind of a skin. And however, the facial have a very few days glow that will be there for 1 or 2 days, and that will not persist at all. And the dry skin people, yes, not the sensitive people, sensitive skin people, the dry skin and the normal skin can get done a facial, but however, many facials won't be very helpful. It will be the glow of 1 or 2 days only. So this is one thing. And then coming to the coming to the the diet in the skincare. Okay, so yeah, before that I will tell you about some masks what you can use at home, being at home. Okay, so what you can do as a general routine, okay, in at home. So it's like first is a cleansing. So oily skin, I told what to use. It's about the salicylic and the glycolic and the little bit stronger cleansers. You can go for that. And uh, once in a week or twice in a week, you can use at home uh, the rice powder or the besan powder, besan atta, and the rice powder, and or the oat powder as a scrub of the face. Okay, so first you can do the scrubbing of the face with this, and then you can just around 2 to 3 minutes you can scrub with this, and then you can go for a steaming. Especially the oily and the combinations and the normal skin people can take steam on the face, but never the dry and the sensitive skin people should take, because it will cause more dryness on the face. And then when the steaming is done for around max 5 to 10 minutes, it's enough. And then after that, if you have a good sterilized compound extractor, you can just try to remove the blackened and the whited around the nose, or some which one are popping up as a blackened and whited, not the active one. Do not touch the active acne at all. Okay, and you can just pop them out. You can cleanse it off, and then not do not the compound extraction should not be done which are not coming. So you don't have to put pressure on the face and then try to remove that. Okay, and then then after that you have to use a mask. So because the pores are open and the cleansing is done, and the mask is needed to cover up that. So for that, the very best home care mask is like a ripe banana. You can take half a ripe banana and add a spoon of honey in it. And for a oily skin, you can go for a skim milk. And for the normal to dry skin, you can use curd in it. Okay, and then you can just mix, apply to the entire face, leaving around the eyes, and you can apply on the lips. There's not a problem. And leave it for some 15-20 minutes, and you have to wash it off. So after this, if you have any kind of and do not rub the face. You have to pat always. Every time you wash the face, do not rub the face. You have to pat dry it. And then, after this, you can apply a serum, especially a vitamin C serum, or the which was being prescribed by your dermatologist. There are some night serums or something you can use, and you can use the vitamin C serum. That will be helpful. And uh, then apply it and keep it like that. And then always make a habit of applying a night serum always, or a night cream always. So the more than 30 age people can start using a retinol containing serum, or there are many night serums that you can get advised by your dermatologist. They will suggest you according to your skin. And some people who are having a pigmentation problem, there are certain skin lightening serum that which are safe. Yes, and when you come to about the skin lightening thing, so this is a very big problem in Indian scenario. So the skin lightening, uh, don't just start applying anything just your parlor told, or just you just went to the medical shop, and then you have been given some tube. See, all those tubes, most of the time, around 80% of the time, can contain a steroid, and steroids are very very bad for your skin. And those whenever you apply steroid containing skin lightening cream, so you'll have immediate results in that, and you feel really good about your skin, and then you keep on applying. And we see many patients who are like like just keep on applying those cream, and they use it for months and years. That's like pathetic about it. They use it, and then they have very severe sensitive skin, and the skin starts the thinning out, and redness is there. And the moment they start stopping that steroid cream, the skin become more pigmented, more sensitive, more dry. So because of that, patient again applied. So they really, it's like an addiction. So they are that bad. So do not use a steroid cream at all on your face. So before applying any kind of a cream, make sure you consult a dermatologist, even though you have to go for a routine checkup also. So just you might be not having any problem. So just to know what to be done on your skin, you can just go, because there are a lot of things they are there in the market. You might get confused what to be used, and it will be a waste of money for you. So all these things you have to take care. And um, yeah, so these are the face packs you can use. And for a dry and sensitive skin, you can just use honey as your face pack, nothing at all. So just do a oat scrub and just do a honey mask, so that will be best for your skin. And um, you can yeah. So coming to the food part of the skin. So um, yeah, here Dr. Nikita Kashyap is asking how to remove black spots on our you know on a face. Yeah. See, see black spots again. So as I discussed, it's about the uh, pimples that you might have popped up. And then so all those spots. Okay, so it has to be, there are certain kojic acid creams, and there are Albutin, which is a new thing. Do not use a steroid on it. And there are many combinations. Okay? So you can go for such kind of cream at night, and use a sunscreen. That is very important. And whenever acne is there, do not pop them out. And when there is acne is active, what you have to do at that time. So during this active acne, see, whenever there is an active acne, so whenever there is an active acne, see, what you have to do, you'll get benzoyl peroxide creams. Okay, like benzoyl peroxide creams you can use. So you can just take benzoyl peroxide and apply on the spot, and do not leave it more than 10-15 minutes. And always use it for a layer of moisturizer. If you have too much of oily skin, you can apply a thin layer of it, but do not apply it around the eyes and around the mouth. It's a very strong cream, so do not apply it for a longer time. Okay. So that you can do, so you can prevent the dark spots like that. And yeah, coming to the diet aspect of the skin. See, skin basically depend upon what we eat and how good we hydrated are. So in the oily skin, so we'll suggest to avoid oily food. We'll suggest oily food contain all kind of a fried junk food and everything. And then sweets has to be avoided in acne prone and oily food. And then okay. And then you have to avoid milk, even milk. Okay, milk has to be avoided, because some people have a habit of taking 1 to 2 glass of milk daily, a half a liter or more. So that's too much. So the animal hormones which are there, even they are prone and to cause a new acne. And even some chocolates, yes, chocolates also have a problem. Yes, dark chocolate is good, 1 or 2 bites, but not more than that. Yeah, these all food have to be avoided in the in kind of oily skin. Yeah, there is Samir. Uh, Kindly skincare for a oily skin. Yes, Ami, we are already discussing about this. So, so just to tell you again. So, skincare for oily skin is like you have to, wash your face minimum 3 to 4 times a day. So, with a salicylic containing food, you have to salicylic containing face wash. You have to wash your face, and so use a moisturizer regularly. So there are good moisturizers available like a Hydronic, a Soft AC, or any other good moisturizer which are non-oily and non-comedogenic. You can go for a non-comedogenic moisturizers, which will be helpful. And use you can use at home a multani mitti mask or a sandalwood mask, and you can for a pot and or a basin as a face wash or a face scrub. So those will be helpful. Yeah, yeah. And if you have a active acne, if you have a high grade of acne, I'll suggest better to meet a dermatologist. Okay, so because only one or two acne, yes, you can manage. But if the acne grade is it's better to meet a dermatologist. Otherwise, you end up in having a lot of acne and the scars, and you end up in a permanent scars on the skin. So that's the reason acne has to be treated early. So yes, earlier it can be. It was told earlier. It was like, yes, acne is normal. It will come and go. It will not be a problem. But because of our diet, because of our lifestyle and everything, there are a lot of changes. So for that reason, I would suggest acne is one very common thing in India that you have to take care. So, like early treatment of acne will prevent the scars permanently, and early treatment of acne will keep your skin spotless. Yeah. Yeah. Yeah, Dinesh is asking, what are the kind of care need to be taken when you're at home? Yes, Dinesh, we are discussing about that right now. Like I told about various masks we can use at home, like depending upon the um, uh, various kind of um, type of a skin. Okay, first is cleansing. Even though at home you कि I don't need to wash. I don't need to wash face very regularly. I'm not going out. My face is not dirty. So it's not like that. So there is a blockage of the pores. There is secretion of the oil. Now at presently the hot and humid climate. You are more prone for the acne. So that's the reason the frequent washing of the face is very needed. And then follow, you can use a salicylic containing face. You can get easily the face washes like Neutrogena is very easily found, so you can take that. Okay, yeah. And then you can use some masks at home. So as I was telling, if your skin is oily, you can just go for banana honey mask, and then don't use a cream of the milk if you have to add a milk in it. So these are the things. And then yeah. So make sure ki you have to wash your face at night and sleep. Yeah. So that's the um, yeah. So glycol peels. Yeah. So glycolic based cleansing can be used. Yes, you can use the glycolic containing peels. Mm, yeah. I just told Shiv Shankar is asking, is there any um, home-based remedy for the oily skin? Yes, we are discussing that. Uh, Used for oily skin, Ruby Das. The salicylic containing face washes are good for the, and the glycolic containing face washes are good for the oily skin. Yes. And coming to the food, so I was discussing about the oily skinny food to be avoiding is the oily food, sweets, milks, and chocolate. So these have to be avoided. And the dry skin has to go with lots of eating nuts, flax seeds, antioxidant rich food. Those are very helpful. Yes. water is very very important. Minimum 3 liters of water has to be taken. Okay, so you have to take minimum 3 liters of water. So being at home, you may miss taking that, you may not feel thirsty. Yes, you have to keep a 3 liter bottle, and you have to make a target, put a reminder on your phone or something. But always take always you have to drink water. Okay, so it could be in a form of the buttermilk or some other kind, but you have to take 3 liters of water a day. Okay, and so this is there. And then yeah, so these are about the food. And yes, so face cleansing is prescribed 3 to 4 times in a day. Yes, yeah, right. And which is the preferred sunscreen for oily skin? See, for the oily skin, see, you can go for a non-comedogenic sunscreen. Okay, like silicone-based sunscreen are good, and water-based sunscreen are good. So, so these you can go for those things. Okay. Yeah, and mm, yes. So we'll now talk about the non-facial skin. Non-facial. We'll talk about the non-facial skin mm, care. Okay. See, even you have to take care about the body skin. So it's like you have to do a frequent scrubs for the body skin. Yes, scrub mean that doesn't mean that you have to do a daily scrub of the skin, like using some wire brush or kind of a loofah too hard, or some kind of jute or something. So no. So it's about the once or twice once or twice a body scrub is enough for a skin. Okay, and enough for a body skin. So like um, yeah. So once or twice a day is enough. So we see many patients who are having who have a um very bad habit of just scrubbing off the skin, just doing the scrubbing of the skin again and again and again, and that leaves a permanent kind of marks on the hands or the clavicle area or some back area, upper back area. We see them very commonly. So those are called as a frictional dermatosis. So that is due to the friction, and they think that's a dirt or something that has to be removed. They keep on that rubbing the skin, so that should not be done. So just a second. How should I take care of my dry skin during summer? Yeah, yeah, Vaidhi. See, dry skin during summer, your skin can become more dry, because the Pune's climate is also dry. It's not humid. Okay, so you have to take a good care, otherwise you'll have kind of a sunburn, and all those things. So first is hydrate yourself. That is very very important. And use a repeated moisturizer on your skin. Do not use any kind of a hard face washes, like which contain salicylic or glycolic or some other lactic containing face washes. Use a foam based face washes. You can use those will be helpful for you. And sunscreen of more than SPF 50 is required. You can go for a the oil based sunscreens. So those will be helpful for your thick cream oil based sunscreen and a moisturizer. So you can it can be sometimes confusing whether you have to use a moisturizer first or a sunscreen first. So many patients ask us, it's always anytime a moisturizer first, and then over that you can apply a sunscreen. And over a sunscreen you can apply your talcum powder. There is not a problem. Or you can apply compact powder. There is not a problem. So this is about the sun care you can do. And yeah. Mm. You can use a honey, simple honey as your mask. You can even go daily basis also. Honey mask is not at all harmful. Yeah. So these are the things. And yeah, about the body skin care. So you can go for a basin, and curd and turmeric as a scrub, and once or twice a week. You can take a bowl of it, and then you can just before bath, just 15-20 minutes before that, you can just apply, especially concentrating on the elbows, knees, on the and the back of the hands. Yeah, so you can go for this kind, and then you have coffee and sugar scrub. This is also very good and hydrating kind of mask you can use. And yeah, and yeah, this is the thing you can go for a body scrub. And yes, do not forget about your food. So scrubbing is needed. You will get a pumice stone, and keep your food well moisturized. You can get many kind of hydrating food masks nowadays. You can go for those, but don't go for a food peel. Okay, peel has to be done in a the professional from a dermatologist. So don't get just a food peel, because it can cause a lot of allergies and all. So it's better you can do a scrubbing, and you can just apply some mask on the food, so that will be good. And then you can just take care about your food like that, and then repeated moisturizer. And during this this condition, you use a lot of sanitizer on your hand repeatedly. That will cause a lot of cracked hands, and then sensitive hands and all the things. So when you always use a sanitizer, you can keep a bottle of moisturizer by the side by, so that you can use the moisturizer immediately. So keep applying the moisturizer repeatedly. Otherwise, you can get the hand eczema problem. And because hands have been repeatedly used, and a lot of like cleansing and the detergents are used nowadays because of this. So those all causes a lot of dryness. So that's one thing, you have to use a repeated moisturizer. Okay. And how to prevent this? Tanning on the face naturally. Yeah. See, when it comes to tanning on the face, so if there is a minimum tanning, yes, you can get it removed at home. Okay, you can use some scrubs. It's okay. That's exfoliation that will be done. So you can use a very mild scrub, like a oat scrub. Okay, oat scrub is like hydrating and a good exfoliating, so it's good. And then you can repeatedly uh, once or twice a week, you can go for this very simple banana honey mask. And you can add a turmeric in that. That will be having a good tan removal thing. And yes, you will be tempted to add lemon, but do not add lemon. Okay, lemon will cause more irritation on your skin. Okay, so there are more of people using lemon, lot of lemon. So using of lemon directly applying on the face, the juice of lemon that's directly applying on face, can cause something called as acquired ochronosis. Acquired ochronosis is people have a tendency of applying the lemon and the related products on the face, which will cause a permanent pigmentation of the face or the area which is being used. So avoid lemon kind of citric acids in your masks. So if you have to use it very very, or I'll suggest not to use them. Okay, and then um, this turmeric is a one good tan removal. So repeat it twice a weekly, and do a face scrub with the oat, and then sun protection, yes, and night cream, of course, with the kind of like kojic acid or arbutin containing um, the night serums you can use, or a glycolic containing night serum, which helps in exfoliating your face. So those all will be helpful to remove the tanning. Yeah. Yeah, so that's about the tanning. um, so yes, we have to. There's someone, Samir Sani is asking, can we use sunscreen in acne? Yes, Samir, you can use sunscreen in acne. Yes, because see, when you are exposed to sun, the acne prone skin have more acne. when there is a more of sun exposure, there is something called as a rosacea. Okay, so that looks similar to acne. So that's all increased during the sun exposure. So sunscreen is going to help you in preventing the acne and or a rosacea kind of a condition. And there are some good sunscreen nowadays which are a silicone based, non-oily based sunscreen, and which are non-sticky. Those are a nanotechnology one and silicone one, which will help as a very good sunscreen. That is some sunscreens like acne UV. Acne UV sunscreen is a very good sunscreen for acne prone some acne prone skin. So that's really non-sticky and okay, and really you'll never feel kind of a stickiness on the face or oiliness on the face. It will fit on your oily skin. Well, you can try that somewhere. Yeah. So coming to the the body care, these are the scrubs you can use, and then yes, how about the hair removal in this kind of environment? See, there is a myth that shaving of the hair on the body is going to grow more hair. So it's a myth. It's not like that. So it's never grow new hair or a thicker hair like that. So what you can do in this type is like you can shave off your body with new razor. Okay, so you get nowadays a very good kind of a razors, which are triple razors, and a gel pad on it, and or a moisturizer on it. So all those thing kind of erasers you get it. So you can use those kind of eraser, and never shave your body with dry skin without any using directly like a dry razor should be avoided. So you can use some kind of a lotions or a foam or kind of a conditioner you can use or to shave. Okay, and yes, you can even shave the face area also. So so shaving of face is again a myth that will cause more thicker hair growth, and we for our hair removal patients we tell them that in between the sessions you can shave the hair. So they are literally shocked, like, doctor, how can we shave our face? It's like it'll grow more hair. No, actually it's a myth. Okay, so why does the hair grow thicker? Because of the hormonal changes. Why does males have a thicker beard? Because of the hormones which are like sensitive in that area. That's caused the thickening of the hair. But people don't have thick hair, will not. So when you shave, there is not a problem. You can just use a foam and shave off the face. Even it will remove that layer of the skin, and then your face become more better. You can, and always whenever you shave your face, make sure you have to use a good moisturizer or good packs, moisturizers after the shaving. And even when you shave the body, you have to cleanse off. You can use astringent, or you don't have a astringent, you can just take a good bath with the soap and water, and then you have to use a moisturizer it. And avoid using tight clothes at least a week post shaving, and then avoid kind of a oil application just post shaving, okay, of your body. And yes, we are talking about the shaving. So you have to use a new blade always. So these all things should be taken care. And so yeah, so so finally we can end the discussion here. So the take home message here is like six basic things to take care at home: cleansing, moisturization, and sun protection, and healthy diet, hydrate yourself, and quit smoking, and have a good sleep. Yeah. So I'm going to end this. Thank you. Bye.